problem statement, revisiting the evidence and strategic focus. And so we're going to do a final review of our action plan, and then look at community actions or announcements in upcoming meetings and then adjourn. But before we get started, I just want to make a point. The work that we're doing is very important. As you know, there's a disproportionate number, a high number of pregnancy-related complications and deaths. And that's, what we're going to be doing is looking at the systemic issues. And we're going to be tasked with looking at those systemic issues and being charged with looking at actionable steps to be able to address, maybe not resolve all, but address so that we can make some common ground in making a difference and having some sort of impact in our communities. And just so that you know, these complications related to pregnancy-related deaths and other complications are not only related to certain socioeconomic populations, but it goes across the board. So how do we infuse that theme of equity, that theme of addressing social determinant of health, and bringing in that health literacy portion of it so that we can better be equipped as a county to move forward and show better outcomes in the future. So with that said, I'm going to pass this on to Shanae and AJ so they can move us forward as we go forth in this journey. So again, thank you all for all the work that you have and continue to do in these particular efforts.
Well, that was wonderful, Dr. Cooper. I appreciate that. That was a wonderful, warm welcome. And again, thank you all for joining us today. And for those who are just joining us, I do again just want to apologize for being off camera. The connection has been stable given the weather recently. So I appreciate your patience with me as we go through today's agenda or today's topic. And so in usual form and fashion, I always like to just do a quick regrounding, especially this is our final time because this is our final review of strategies. And so I'll share the problem statement and the data that helped to guide this work. And I know we have a few new faces with us today, so I think this will be great for them to kind of see how this all started. We had a problem statement that was selected by our Community Health Improvement Plan, or our CHIP steering committee, which highlights that many pregnant people lack consistent prenatal and postpartum care, particularly those with Medicaid or without insurance. And as we grounded ourselves in the data, the 2025 Community Health Assessment, or the CHA, highlighted some important challenges here in Prince George's County. And what we're seeing is that we're seeing higher rates of late or no prenatal care compared to the rest of the state. Alongside that, maternal mortality rates are also higher than the Maryland average, and we continue to see those elevated rates of low birth weight. And, we do recognize that this represents real gaps in access and support and timely care. And we know that when prenatal care is delayed or if it's missed, it increases the risk of those preventable complications for both birthing parents and the babies. And importantly, these challenges, I think, disproportionately impact communities that are already facing those systemic barriers, similar to what Dr. Cooper was sharing just moments ago. So it really is important that we continue to work together to find ways to just make sure that everyone who can has equitable access to early and that high quality and that culturally responsive care. And so through our root cause analysis discussion that we had earlier this year, we identified one strong starting point to help guide our brainstorming. And this group in particular selected system navigation and care coordination, specifically how we want to improve the ways that families find, how they access, and how they move through those maternal and infant health services. And then from there, we discussed, what success could look like over the next 3 years, because this CHIP, this Community Health Improvement Plan, is a 3-year document. And so what success looks like in that 3 years, we identified some common themes to consider, like community input, like patient-provider communication. We talked about some traditional versus non-traditional approaches, access to care, culturally and linguistically appropriate comprehensive care. And so those themes helped guide the development of the goal and objective statements that I'm going to share with you in a moment. And so the goal statement that you all voted to prioritize for this action plan was centered around improving equitable access to timely and continuous prenatal and postpartum care. And so at its core, this goal focuses on just ensuring that all residents have that equitable access to care. And we wanted to emphasize, reducing disparities, improving early engagement in care. We wanted to emphasize supporting those healthy outcomes for birthing parents and infants in the county. And so we had some discussion around the goal. We had some discussion around objectives. We asked for some feedback with a survey. And so we drafted these two objective statements. That are aimed at addressing this goal. And these objectives really focus on increasing early entry into prenatal care and then strengthening that continuity of care after birth, all through this coordinated, culturally responsive outreach, community-based supports, and then better navigation of trusted services in high needs communities. And so you'll really see these themes reflected throughout the proposed strategies that we all talked about. And so as we transition into this final review, I do just always have to extend my sincere gratitude. I really am just so thankful for everyone, for your time, for your expertise, and for your perspective that you all have brought throughout this process. I know we've really broken it down into little chunks, but your patience has gone a long way. And over the past several meetings, we've had some really thoughtful conversations around maternal and infant health, around barriers to care, the health equity component. We talked a lot about community trust and the systems challenges that families continue to experience when trying to access prenatal and postpartum services. And so I just want to say, your feedback has truly helped shape the direction of this work, and I'm hoping you all see that reflected in this final review today. And so today really is intended to just, again, serve as this final review and discussion of those proposed action steps that we all worked through together. And what I hope that we can achieve today is to walk through these strategies to make sure that they still feel aligned with the priorities we identified, to make sure that they feel realistic, that they feel actionable, to gather that last little bit of feedback or any final refinements before we write this final chip, and then to really confirm that we have the right partners identified, because I know we talked a little loosely about that last month, but I just want to make sure we're not missing any organizations or partners that could help us with the implementation of this plan. And so with that, we can go ahead and walk through this proposed action plan together. Again, the goal that this group selected focuses on improving equitable access to timely and continuous prenatal and postpartum care. And throughout our discussions, I think one thing that became really clear was that improving maternal health outcomes requires much more than just simply increasing services or simply making people aware of them. It's much deeper than that. It requires that early connection to care. It requires that trusted and culturally responsive information, strong partnerships, coordination, community-based support, navigation assistance, and then, finding ways to reduce those barriers that prevent families from accessing care consistently. And so you'll notice that many of the strategies for prenatal and postpartum care we talked about, they naturally overlap because the barriers and many of the solutions were somewhat similar across the maternal health continuum. And so last month we worked through the prenatal strategies, and then we worked through the postpartum strategies. But today we've organized the discussion around those shared strategies that support both objectives. And so I'm going to go ahead and start with strategy area 1, which focuses on strengthening community partnerships and referral networks across both prenatal and postpartum care. And so one thing this group emphasized early on is that timely access to care really depends on, or often depends on, how quickly and effectively residents are connected to those services, whether that's early in pregnancy or post-delivery. And so these action steps focused on building stronger coordination between those prenatal and postpartum care providers, the hospitals, the FQHCs, WIC, pediatric providers, doulas, CHWs. We talked about behavioral health providers. And we had some conversation about what that could look like. And so we talked about potentially hosting listening sessions or forums between those care providers, in the sense of like, how CHWs work with providers, how doulas work with providers, to learn what these working relationships and networks currently look like, or to explore other models of care that they may be considering or may be implementing. And I think it was Annie who mentioned that IMHS has regional coordination teams, and they're looking to facilitate these perinatal care coordination conversations. And so that might be something that the coalition can help support instead of, duplicating that effort. If it's already happening, let's find ways to enhance those efforts, so we can all be successful in this. We also discussed promoting and maintaining a shared referral and resource directories. So I think concierge care was mentioned, MD Mom was mentioned, findhelp.org was mentioned, all to make it easier for those providers, for navigators and residents to find and connect to available resources and supports. And so I think overall the goal with this strategy area is really just improving that continuity of care, strengthening those referral pathways, and making navigation easier for families. So I know that was a lot, but I just want to make sure that I just want to make sure that we captured those conversations accurately. Are there any final thoughts on this particular strategy area, and particularly looking at this partner list? Do we have the right partners represented here? And you're welcome to use the chat, or you can unmute yourselves.
I think this looks great, Shanae.
Oh, awesome. That's wonderful. Okay, thank you. All
And
right,
I think this is going to be a great roadmap for us to be able to refer back to make sure, like you mentioned earlier, that we're in alignment with what we want to accomplish, because there are so many priorities out there,
yes.
but this allows us to address a subset of that inch by inch.
Awesome. I love that. Thank you for that feedback, everybody. And again, thank you for your collective thoughtfulness in all this. All right, moving on then, we'll go ahead to strategy area 2. This strategy area focuses specifically on culturally responsive outreach and education. And this was another major theme throughout our conversations and we emphasized, that residents need information that is trusted, that's clear, that's linguistically and culturally appropriate and relevant. And whether that's talking about early prenatal care, postpartum warning signs, maternal wellness as a whole, maybe we're talking about infant care, just understanding how to access services. One thing that Rodrigo mentioned that really stuck out to me was that access to information doesn't necessarily mean people will utilize it. The information is out there, right? But it's more about the places and the people that they can trust to give them that information, to connect them to those resources. And so I think that's what these proposed strategies that you all came up with really reflect. It's identifying and partnering with those trusted community organizations, those trusted messengers, to help share that health literate and culturally responsive educational and resource materials, and not just any material, but materials that have been vetted by those trusted messengers, all to increase awareness of and assist with connecting those residents to those available and trusted maternal infant health resources across priority populations. And some of those populations that we're considering were those with Medicaid or no insurance, those with limited English proficiency. We talked about addressing those who experience this sense of isolated motherhood. We talked about low-income immigrant communities. Okay, so just, to consider some of those populations, those priority populations. We also discussed the importance of showing up consistently, becoming a familiar face in community spaces and events where residents already feel comfortable and connected. And so bringing, community education events and sessions and community events in those spaces that already exist with those trusted partners. And I think the broader goal here is really just to increase awareness, increase trust, increase engagement with community and earlier connection to care and support services. So again, I'll pause here for any additional thoughts, any other gaps or populations we should be considering, any partners we should be considering. And I'll note this is the slides are just to provide a quick snapshot. We have the much more detailed action plan that we'll use internally. I think I saw a virtual hand raised. Is that Sharon?
Hi.
Hi,
Yeah,
Sharon.
hi, how you doing? I just had a question about there are success measures and then long-term impact. And I was wondering how the interventions are going to be evaluated and who is doing that. I don't think we have a budget, but I guess my concern is that if we're not evaluating the interventions and documenting change, we won't know if these are successful and worthwhile.
Yeah, I agree. So that's something that we talked about, I think it was in the last meeting or maybe the meeting prior was, again, this is a 3-year plan, a 3-year process. And so, being very specific and very targeted in our outreach, whether that's using a convenience sample or a subset population and using that first year to kind of gather that initial data and then tracking it over the next over year 2, over year 3 to see if any significant change has been made, whether that's in access, whether that's in awareness of resources, utilization of resources, things of that nature. So that year 1 is really just kind of setting that baseline. Any other thoughts or questions? Okay, we'll go ahead and move on to our third strategy, which focuses specifically on care navigation and connection to services. So another thing that this group highlighted is that, access is not just about services existing, it's about whether residents can actually successfully navigate the system and stay connected to care across pregnancy and postpartum. And so these action steps really focus on expanding outreach and navigation support through CHWs, doulas, patient navigators, those care providers, community partners, particularly for those residents that will identify who, are facing those barriers related to insurance, transportation. We talked about, working with residents who have identified scheduling complexities, childcare issues, and just that overall system complexity. And then we talked about some strategies around, excuse me, strengthening connections or strengthening those links to comprehensive services overall across the care continuum. So not just medical care, but being able to connect those residents to WIC, to behavioral health support. Maybe it's lactation support, pediatric care, food, housing, transportation assistance, whatever that may be. But just being able to get them connected and make them aware of those comprehensive services. We also talked about the importance of, identifying and having those co-located services so patients don't have to go to multiple places for care. And this is where we all mentioned, that FQHC model in particular is really important because it helps to reduce the number of places and locations people have to go to seek care and services. We also had conversation last month about utilizing those trusted third spaces, so barbershops, the hair salons, places of worship, and utilizing those spaces to share education, to perhaps host a support group, to create that network of peers that could essentially mentor each other between and during visits. And then we also talked about finding creative ways to reduce barriers specifically related to transportation and childcare for people who are actively seeking and attending care. And so, of course, this will take a creative approach, and we'll have to see what kind of funding and things are out there to make some of this possible. But we're all connected to someone or something in a lot of different ways. And I think if we continue to bring our expertise and our connections to the table, that we can make an impact somewhere, some way, even if it's only a minor impact. I think I always like to say, I know I can't change the world, but I can change someone's world. And so even if I can make the impact on that one person, like I have to consider that a win. And so with all of us at this table here, I know that we can continue to put our efforts into impacting our county and impacting the people who live, work, play, and visit here. And so I think this section really just reflects the group's emphasis on, just trying to make maternal health and healthcare just more connected across systems. So with that, I'll open the floor again for any final recommendations or specific partner additions for this section. Any populations we're overlooking, partners we've missed? Patrice?
Yes, hi.
Hi.
Question, I know I'm late. I know I'm late to the game in this, but
Okay.
I was looking over at this particular strategy, and since you mentioned as part of the success measures indicating the Medicaid clients, I was wondering, would or could the MCOs be considered a partner in this, because that would be a pathway for them,
Yeah,
linking them to the prenatal care?
absolutely. Thank you for mentioning that. I will make sure we include them in that.
And if
Wonderful.
anyone has any connections to any MCOs, please invite them or extend an invitation to them to attend these meetings, because they're critical in this particular path that we're trying to create.
Yes.
Will do.
Absolutely. Wonderful. Thank you, Patrice. Thank you, Sharon. Dr. Any other thoughts? All right, hearing none, we will move to our last strategy, which focuses on identifying and addressing barriers to, well, this says prenatal care, but it should be prenatal and postpartum care. So I will correct that. Sorry, let me just make a note here. Okay, and so with this strategy, our group talked about those barriers, and we've mentioned them a little bit before, but things like transportation, the insurance gaps, childcare, scheduling challenges, mental health access. And then last month, we also talked about some barriers that don't get talked about too much, which centered around stigma and gender-based or domestic violence, which Rodrigo was sharing was found to be directly tied to seeking care. And so, we just want to make sure that we're considering those unique barriers as well as we, excuse me, create some approaches to our strategies. And so these action steps really focus on just trying to continue to engage residents and elevating the community voice directly. Excuse me. And so we talked about surveys, and then we had some conversation about how it's a little bit challenging to gather, to get people to respond to surveys. And so then we talked, okay, well, what are some other creative ways that we can gather that community voice. And there's mention of focus groups and support groups and listening sessions, having those community forums or community conversations in those trusted spaces. Maybe that's at a place of worship, maybe that's in the barbershop, maybe it's, at a library. And just trying to be creative in our approach to gather that community voice, to really just try to better understand how those barriers impact people, and not just people as a whole, but we know there are different populations and different communities that exist in this county. And so finding ways to get those varying and diverse community voices, and then to identify those solutions. I know La Clinica did something very similar recently. And I would love, I don't know if Rodrigo's on this call, but I would love for them to come and present their approach to how they were able to gather that community, their community voice for the population that they serve. But I think that's something that we could potentially apply to other populations and tweak a little bit, of course. But yeah, just trying to be creative in that approach. We also discussed the importance of once we get that voice, once we get their input, but sharing that input, sharing those findings with providers, with our partners across the coalition, with decision makers, to help inform those service improvements and those system level changes. And I think ultimately this goal is to just work together to try to support those barrier reduction efforts. Again, looking creatively into transportation assistance, childcare support, flexible clinic hours, maybe it's telehealth options or pop-up or mobile services, those flexible care models where available. And the broader hope is that, these efforts can help better create systems that are more responsive to the community voice, that are more accessible and a bit more equitable for families across the maternal health continuum. And so with that, I'll pause here again for any final reflections, additional barriers that we want to make sure we're capturing here. Partners we may have missed. And the OAP team, for those who aren't aware, that's the data team that works here at the health department. Any other partners we should be considering? Okay. All right, well, hearing none, we'll close out. Overall, I think these action steps really just reflect again, that the collective input and the recommendations of this work group. So truly, 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 from the bottom of my heart, I sincerely thank all of you for your participation, your partnership, your expertise, your thoughtful contributions throughout this entire process, and for giving us that final validation today. And so over the next month, the coalition leadership, we're going to focus on drafting that CHIP document, gathering some input for review, and then publishing that document. We're still looking at July. We're still on target for our deadline. So I'm excited about that. And we're just really excited to continue moving this work forward. And we will definitely be sharing more updates at the June quarterly coalition meeting, which is coming up, and we'll talk a little bit more about that in a brief moment. But I just want to open the floor for any final thoughts, comments on the action plan, and if not, I'll go ahead and turn it over to AJ. So any last minute thoughts?
I think this is a wonderful working document, and it reflects the needs of the community. And I think it's a good document that helps us to see things through the lens. And I think we need to continue that process, the lens of those populations that we're trying to serve.
I love that. Thank you, Dr. Cooper. Let me see some comments. Thank you, Annie. Thank you for your comment. All right, well, let's go ahead and move on to our community announcements. AJ, take it away.
All right, so Suburban Hospital has shared their most recent Southern Maryland Older Adult Resource Newsletter, which includes a variety of upcoming and ongoing programs, resources, and events focused on safety, health, and wellness for older adults. This newsletter includes programming for Suburban Hospital, Johns Hopkins Medicine, Washington Metro Oasis, and other community partners. We'll make sure to share this out with everyone after the meeting so you can review it, pass it along to residents, clients, families, or anyone else who may benefit from these resources. Next announcement is for Brain Health for Every Generation, hosted in partnership with the Alzheimer's Association and Parks and Recreation. This event will take place on Saturday, May 23rd from 1 p.m. to 3 p.m. at Harmony Hall in Fort Washington with the hybrid option available. The focus of the event is on reducing risk and building resilience at every age. It is family friendly and will bring together experts, neighbors, and community members to discuss practical ways, to support brain health and better support individuals and families affected by Alzheimer's. If this is relevant to your work or community, please feel free to register using the link on the slide. Evermind is hosting a virtual webinar titled 988, a deep dive for clinical integration and crisis response. This will take place on Thursday, May 28th from 6 to 7 p.m., a week from now. The webinar is geared toward healthcare professionals, behavioral health clinicians, care managers, social workers, nurses, emergency department professionals, and others involved in crisis response or care coordination. Participants will learn more about how to integrate 988 into clinical workflows, when to use 988 versus 911, and how to support referrals, risk assessment, and follow-up care. CME and CE credits are available, and a registration link is listed on the slide. Next, Prince George's County will be hosting the third annual Multicultural Festival on Saturday, May 30th, 2026 at Fairwood Community Park. This event is free and open to the public. The parade begins at 10:30 a.m. and the festival activities will run from 12 p.m. to 6 p.m. This is a great opportunity for residents and families to come together and celebrate the diversity of cultures represented across Prince George's County. There will be live music, performances, a large kids zone, food vendors, art vendors, and other community activities. Please feel free to share this with your networks. There will also be a re-entry housing resource fair on Friday, June 12th from 12 to 3 p.m. This will be held at the Bridge Center located at 5001 Silver Hill Road in Sweetland on the second floor. The fair will focus on re-entry friendly housing providers and options in Prince George's County. Returning citizens, families, partnering providers, and stakeholders are all welcome to attend. Lunch will be provided at noon, and remarks about the health department's re-entry housing program will begin at 1 p.m. This may be especially helpful for partners who work with justice-involved residents, housing navigation, behavioral health, or social services. So please feel free to share out. And lastly, this is a save the date for the 2026 Walk to End Alzheimer's, which will take place on September 19th, 2026. Registration is now open and the link is included on the slide. This is a great opportunity for individuals, families, organizations, and community partners to get involved, begin recruiting team members, and start fundraising efforts. With new treatments emerging and continued focus on brain health and prevention, this walk is another meaningful way to support awareness, research, and families impacted by Alzheimer's. So please feel free to share this within your networks as well. With that, turn it back over to you, Sinead.
Thanks, AJ. At this time, are there any other partner announcements? Okay. Well, hearing none, that's all right. If something does come to mind or come up, you are welcome to email me or our PGHAC email address to share your flyers, to share the information, and we'll be happy to share that out with our partners. And it doesn't have to just be relevant to Healthy Start. It could be relevant to any of our coalition members. I think I see a hand. Charmaine?
Hi, sorry, I couldn't get off mute. We are having a community baby shower and resource fair at the Sports and Learning Complex on June 26th. It is hosted by the Prince George's County Healthy Start Program at MedStar Southern Maryland Hospital Center. I can share the flyer via email with you all, and then I'm going to also drop the flyer in the chat shortly.
Thank you so much. We appreciate that. Happy to support. Any other community announcements at this time? Okay. We are still looking for an additional co-chair, so if you are willing and able, we'd love to have you with us. It really is just an additional 30-minute planning meeting each month, and then, of course, your attendance at our work group and quarterly meetings per usual. But we would really, really benefit from a second co-chair, and I'm getting ready to ask. I have people in mind, so I'm almost tempted to just reach out, but I want to give everyone a fair chance to participate if you're interested. So if you are, again, you can email me directly or email PGHAC email address, which I put in the chat for everyone just a moment ago. Let me thank you for your consideration. This is also the last call for our coalition directory. If you haven't done so already, go ahead and scan this QR code, or you can click the link once we send this out to you to provide and update your contact information for the coalition directory. I do just want to make sure that we have an accurate record of all of our coalition participants, and we will also use this directory as a way to ensure that credit is given to everyone who participated in our CHIP development process. So please, please, please make sure you provide your information. I mentioned earlier that we have our full quarterly coalition meeting next month. So we will not have any monthly work group meetings. We will not meet as a Healthy Start work group, but instead we are encouraging everyone to attend our full quarterly coalition meeting. And this is an awesome opportunity for all of our partners across every work group to come together, to be in attendance. This is a great networking opportunity, as well as an opportunity to hear updates from the health department, from the coalition as a whole, and to learn more about the work each one of the work groups has been doing as it pertains to the CHIP specifically, and find ways that we can all work together to achieve this goal of making Prince George's County a healthier place for every age at every stage. And so the meeting will take place on Tuesday, June 9th from 6 to 7:30 p.m. It is in person, and we will provide a hot meal to those who attend. So if you are available, please register. You can scan the QR code, click the link when we send it out in a few. Registration deadline is this Friday, or once we hit the max of 50 people, whichever comes first. And I think when we checked this morning, we're at 33. So first come, first serve. So please, please, please register to attend. And these are, well, we really just have one more work group meeting this month. So if you're interested in joining the Healthy Connections work group meeting next Thursday, you are most welcome to do so. And again, just encouraging all to attend our coalition meeting next month. And with that, we will go ahead and close out a few minutes early. Thank you all again just for your continued partnership and engagement. We really appreciate you all being here today and look forward to seeing some familiar faces at the June quarterly meeting. Have a great afternoon and a great weekend, everybody.
Thank you all again for all that you do.
Thank you.
Enjoy your weekend, everyone. Goodbye.
Thank you.
Bye-bye.
Thank you. Have a great weekend.
Thank you, you too, Ms. Benita.
I can stop it once everybody bounces.
Okay. Let me remove this one.